Hi, everyone. Today I'm presenting a study I co-led with Sam Young and Zoe Dodd called the Evaluation of Outreach Supports for People Experiencing Homelessness in Toronto Encampments During COVID-19. And all of our other evaluation team members are listed on this slide as well. And this evaluation was one of 5 stemming from the larger Marco study, which assessed the effects of the COVID-19 pandemic response for people who are marginalized. So firstly, we want to acknowledge that most of our team is working and living on the traditional territory of many nations, including the Mississaugas of the Credit River, the Anishinaabe, the Haudenosaunee, and the Huron-Wendat peoples. And a few members of our team, including myself, also work and live on the traditional unceded territory of the Algonquin Anishinaabe Nation. And today, these lands are home to many diverse First Nations, Inuit, and Métis peoples. So just a bit of background on the study. So the COVID-19 pandemic, of course, created additional challenges for people experiencing homelessness. This included things like shelters and other congregate living settings posing an increased risk of infection, and critical resources being closed or limiting access, such as drop-in programs, but even places like coffee shops. All this made it hard for people to meet their needs. Thus, many people shifted to staying in groups of tents in city parks or green spaces called encampments. And in response to this, increased visibility of encampments, new and existing services in the community adapted to provide outreach supports, including to address basic survival needs, harm reduction needs, COVID-19 related needs, and shelter and housing. And so we aim to answer the following questions. What kinds of outreach supports, including shelter or housing options, were offered to encampment residents? Did those supports meet encampment residents' needs? And in what ways did supports affect their lives, both positively and negatively? So we conducted a multi-stakeholder, community-based mixed methods evaluation, including a survey and qualitative interviews. And for this, we incorporated an intersectionality lens and the transformative framework in order to amplify the voices of marginalized groups and to center social justice and human rights. And our study timeline began with an environmental scan of the literature and discussions with community members to design the study and create data collection tools. And then we conducted the data collection and analysis, and we're now doing ongoing analysis and knowledge translation activities. So as mentioned, one of the first steps was to meet with community groups supporting the encampments and create this logic model shown here. And I'll just highlight some key points on the next few slides from this. So first, we identified a few main problems related to this evaluation, including the lack of affordable housing and resource allocation, the increasing encampments or invisibility of them and acts of harm toward people living in them, and the basic needs of encampment residents not being met by the city, and also the risk of human rights violations in these settings. So then we also identified key inputs and outputs as well as outcomes, with the latter including short-term outcomes such as supporting people's rights, dignity, safety, and health, and medium-term such as reallocating funds to community-based outreach, and then long-term outcomes such as improving the investment in acceptable permanent housing. And finally, we considered assumptions, including around the importance of community connectedness and people's autonomy to make their own decisions, people's perceptions of safety in different living settings, and the life-saving potential of outreach for people in encampments. And then we also highlighted the external factors that influence outcomes, such as a lack of resources for outreach, lack of public investment in affordable housing, stigma and discrimination against encampment residents, and the bureaucratic barriers. So our timeline for recruitment was March to June 2021 at 6 encampments in downtown Toronto. So just to note that this was before the more publicized and violent evictions that people may have heard about occurring this past summer. And we had a community researcher with lived experience facilitate recruitment, data collection, and analysis, as well as help with the help from the volunteer group, the Encampment Support Network. And then we analyzed our surveys descriptively and interviews using thematic analysis. And for the outreach workers, we conducted 16 key informant interviews with 6 different groups and types of outreach. However, analysis of that data is still underway, so it won't be included in this presentation, not that we would have time anyway. So for the encampment residents, we conducted 127 surveys and 23 interviews with people who had stayed in an encampment, with 39% no longer staying at encampments at the time they were surveyed, and many had stayed in more than one encampment. People often moved around as well from different settings, so to shelters, friends and families' places, and elsewhere on the street as well. And over 30 different encampments were identified as places people had stayed outside. So overall, we found a diverse sample, as you can see here, with ages ranging from 21 to 64, 38% women and 3% trans or non-binary, 25% LGBTQ plus, and 26% Indigenous, 16% Black, and 11% other racialized identities. And the vast majority of people were on ODSP or OW, plus many had other sources of income, such as various street-based activities or odd jobs, though 55% said they had lost at least one source of income during the pandemic. So here and the following slides, I will present our survey and interview data together for each sort of broad topic. And just to highlight encampment residents' perspectives, I will play audio of the example quotes, which are read by our student researcher, Abira. So first of all, we explored how the participants had come to live in encampments during the pandemic. So 17% were already in an encampment before the pandemic, whereas others moved to one from many locations, including 29% from elsewhere on the street, 20% from a rented room, apartment, or house, 16% from family or friends, and only 13% from a traditional shelter. And only half of people we surveyed moved to an encampment for reasons related to the pandemic, as this participant said.
Oh yeah, I heard that in the shelter system, your stuff gets stolen, and there was lots of like COVID outbreaks at the time. And then the hotel program isn't safe for females, so the encampments were the only option.
Other reasons that people moved to an encampment included that they were not able to find housing, they did not know where else to go, they knew people in encampments, they felt that shelters were not safe or secure, or they wanted more freedom than shelters provided.
Oh, well, I mean, the reason why I moved to the encampment is because like there was shelter there. It was like, you know, there was a little community as well. So it was like a lot easier than just walking around, not having, for example, if I had stuff and I left it at the encampment, I was pretty sure it would be there when I came back because the people are there like always. I wouldn't say that COVID had anything to do with it, but like I was staying at my parents' place and then I just had a lot going on. I just couldn't like handle it anymore, substance using and all that kind of stuff. I just needed to get away from everybody. And I ended up downtown Toronto, and it's difficult, like if you've never been homeless before, like to actually know what to do and where to go.
So many residents also told us that once they were in the encampments, they found a trusted community or family, as this participant explains.
You're not by yourself in the encampment. In the shelter, on the street, you're by yourself. But in the encampment, everyone has to look out for each other to make sure you're good, right? That's how you keep a nice home. Everyone plays a part.
And encampment residents often supported each other and worked together on daily tasks, including watching each other's personal possessions, sharing food or other items, and helping people when they needed assistance, for example, with building structure or addressing violence. And while there were conflicts, of course, people did work in various ways to address them.
It was actually a pretty good, pretty nice little community after a while. Whenever things would happen, like fights between people, it would be sorted out between just those two people.
Now, considering the outreach supports for encampment residents, overall, they greatly appreciated the community-based and volunteer supports, with 69% feeling that their basic needs were met. And they ranked basic survival supplies as the most important items they received, including food and drink, tents, and sleeping bags, though many also highlighted the importance of community or peer support. However, adequate housing was the primary need residents identified that outreach was unable to meet, as this person said.
Well, I expected that there would have been more permanent housing options available after all this time, even before the pandemic. They knew there was an issue with increasing lack of affordable housing, and people are suffering. It's a human right, right? Housing is a declaration under the UN human rights.
And some other key unmet needs included phones, mental health support, and bathrooms and showers, though many people also said they got everything they needed. So in addition, encampment residents valued several characteristics of the outreach supports, including consistency and frequency, as this person describes.
They have very strong consistency. They never give up. They just a rainy day, stormy day, anything that is missing, the food or anything that's necessities for us. I'm very glad that they carry on such kind of consistency. Consistency is our need because you need food every day. You cannot skip the food for some day. Yeah, so I'm very happy that they carry on.
And residents also appreciated the outreach group's flexibility and how they responded to their input.
So they had pretty much everything that you would probably need to just ask them or tell them. And that's the thing, if you told them about it, then they would take it back with the group and decide whether or not they could be able to do it for you, and then they'll tell you about it if they can or they can't or whatever. So it's pretty organized and pretty helpful.
And finally, residents appreciated how the supports helped to meet their social needs.
Yeah, and they're constantly texting, calling, making sure we're good, or if somebody gets arrested, they'll call and be like, okay, we have a lawyer set up for that, don't worry. Yeah, they're I wouldn't even call them outreach worker. It's I'm marrying name of BSN volunteer first of all. Haha. And they're just they're friends.
However, encampment residents also noted how they did not appreciate some outreach approaches and instead perceived some as uncaring or judgmental. For example, if it felt more like security, such as when workers were recording what they were doing or telling them what to do. Now, turning to people's shelter and housing experiences, their interactions with city workers were often related to getting shelter offers, but residents experienced these as rushed or coercive by threat of eviction. So among those who had been evicted from an encampment, many just went to stay in another encampment. And 55% of residents said they were ever offered a shelter option by city staff, with 77% being offered shelter hotels. And only 4% of residents were offered permanent housing. And also quite strikingly is that among those residents who accepted an offer, 75% returned to live in an encampment again. So considering the reasons people left shelter or housing, the most common was due to being kicked out among 29%. But many also left or didn't accept shelter offers in the first place due to the restrictions imposed, such as no pets, no guests, or limits on belongings, being too far away, worries about violence, COVID-19 outbreaks, a lack of privacy, overdose risk, and friends' deaths in these settings, disrespectful treatment by staff, not having their health needs met, and just being tired of waiting for permanent options. For instance, as this participant notes, the strict rules and distance from their community supports affected acceptability of shelter. Do you ever accept that offer?
I did, and it didn't last long because it was nothing like they explained. It felt rather like I was almost being jailed. It's such a tight curfew.
Where was it?
Way east, past the beaches. I don't know the neighborhood at all. So yeah, really far from me. I have a pharmacy that I access down here at street names, supposed to go daily. Yeah, and I come down and I get stuck down here and I want to return and then it's late and they're like, oh, you're gonna be kicked out. And I'm like, oh well.
So as for encampment residents' COVID-19 experiences, many participants reported not being very worried about COVID-19. 80% of residents got tested for COVID-19 and 13% of those tested were positive. And most residents were taking precautions to try to prevent COVID-19, such as distancing from others, using hand sanitizer, washing hands, and wearing masks. And some also mentioned not sharing drinks, food, or drug use equipment, and how the outreach helped them to take these precautions by providing supplies. Also importantly, people perceived their COVID-19 risk to be lower in encampments and were concerned about limited precautions and lack of ability to physically distance in traditional shelters. The first person here describes why they weren't as worried in encampments.
Oh, well, it's outside, so the air is definitely cleaner and there's more air circulation, fresh air. We're pretty diligent on watching people, see if they're showing any signs of, we look out, see if there's any symptoms, signs of symptoms anywhere.
And the next person here directly compares their experience in a shelter versus the encampment.
They asked the questions, but they didn't actually give you at any point did they get a test. They were supposed to apparently do this warming thing with your belongings to put you in this warming room. That never happened. I didn't have to go take a shower. It's just a lot of stuff never happened. Although some people will come by and stuff, I don't have 100 people coming into our encampment and we're not all eating at the same tables or the same area or lining up or using the same showers or anything like that. I would say it's a lot less risky. You don't have doors that you have to touch them and there are other people that are touching them or elevator buttons or any of that kind of stuff.
So finally, people's health and substance use experiences in the encampments included that almost half of residents did not have all their healthcare needs met, and on average had relatively worse mental health than physical health. And the majority were using at least some substances that were not prescribed to them, whether legal or illegal, with 38% of those injecting substances. And the most commonly used were crystal meth, cannabis, nicotine, crack cocaine, fentanyl, and alcohol. Also, critically, the overdose crisis was an important part of encampment residents' lives, as 29% had experienced and 79% had witnessed an overdose requiring naloxone. However, residents said that overdose was less likely in encampments versus shelters and shelter hotels because people could more easily watch out for each other in encampments and did not have to worry about being harassed by shelter staff, which led them to dangerous ways of using, such as rushing their injection or using alone and hiding after. And one person here describes the situation specifically in the shelter hotels.
Well, it segregates you so that you're all by yourself and loneliness takes away a third of your life force as is. There's no one to check in on you. That's why lots of my friends died in the hotel program because they're using fentanyl needles and no one is checking in on them, right? So they just sit there depressed in the room and then in the encampment, your friends, people will come and say, hey, I'm going to use, can you come check on me in a bit? And you go check on them in a bit, right? Because you can.
So in addition to highlighting the types of outreach supports that were most helpful, encampment residents appreciated the ways in which outreach was provided. And their greatest unmet need was housing, though they also emphasized needing phones, mental health supports, and access to hygiene facilities. And current temporary shelter options did not meet their needs for numerous reasons, so most refused or left these options. And many residents felt that staying in an encampment was safer than other shelter options in terms of their COVID-19 and overdose risks. And overall, our data really just points to a situation where as long as housing affordability continues to be a significant problem and acceptable shelter alternatives aren't available, encampments will continue to exist. So as for our recommendations, ultimately, providing suitable permanent housing should be prioritized, as should addressing unsuitable conditions in the temporary shelter system, including COVID-19 and overdose risks. However, in the meantime, community-based services should be supported and empowered to expand their outreach activities to encampments, to hand out survival supplies, to meet basic needs, be offered frequently and consistently, be flexible and responsive to residents' input, and support residents socially and to maintain their connections to community. And encampment residents should not be pressured into leaving or entering shelter or housing that does not meet their needs. And encampment residents should be included in decisions about encampments, shelters, and housing to ensure that all these options meet their needs and respect their dignity. And then we just wanted to highlight some of the other knowledge translation that we're doing. Well, first we did a healthy debate article, so the link is there, and we're doing some ongoing meetings with local community and city stakeholders individually. And then if anyone is interested in more information, you can check the Marco website over the next month. There should be brief reports and full reports posted, and a town hall event. And some of the other evaluations, just FYI, we're also focused on homelessness services, so they may be of interest to others as well. You'll find their information there too. And finally, we just want to thank the study funders, the larger Marco team, and of course the participants and community groups that were essential to completing this study. And please feel free to contact myself or the general Marco email for further information. And thank you so much for listening.